Hello, everyone. On behalf of the National Collaborating Centres for Aboriginal Health and Infectious Diseases, welcome to today's webinar, Separate Beds, A History of Indian Hospitals in Canada, 1920s to the 1980s, presented by Dr. Maureen Lux. My name is Donna Atkinson. I'm the manager of the National Collaborating Centre for Aboriginal Health, and we are located on the traditional territory of the Lheidli First Nation in Prince George, BC. I'm joined today by my colleague from the NCC for Infectious Diseases, Margaret Haworth-Brockman. She's the Senior Program Manager for the NCC for Infectious Diseases located on Treaty 1 territory and the homeland of the Métis Nation in Winnipeg, Manitoba. We will be moderating today's webinar, including a question and answer session following the presentation by Dr. Lux. This webinar is being brought to you today as part of the National Collaborating Centres for Public Health Knowledge Translation in Public Health Medicine webinar series that we are doing in partnership with the Public Health Physicians of Canada. The NCCs for Public Health were established in 2005 with funding from the Public Health Agency of Canada. The NCCs are each focused on a specific topic area, including Indigenous health, infectious diseases, environmental health, healthy public policy, determinants of health, and methods and tools for knowledge translation. Right now, I'd like to hand it over to my colleague, Margaret Haworth-Brockman, to discuss a little bit about this webinar series.
Thanks very much, Donna. None of the presenters at this session have received financial support or in-kind support from a commercial sponsor, and none of the presenters have potential conflicts of interest to declare. The presentation and its slides have been reviewed by the chair of the Scientific Planning Committee. None of the members of that planning committee have received financial support or have any conflicts of interest to declare. In 2008-2009, a competencies working group for medical officers of health with the support of the Public Health Agency of Canada developed a set of 8 minimum medical officers of health core competencies to establish common roles and responsibilities across the country. Knowledge Translation in Public Health Medicine webinar series was developed collaboratively by the National Collaborating Centres for Public Health and the Public Health Physicians of Canada to build that workforce capacity to attain and maintain the minimum MOH core competencies. Today's webinar is a collaborative that involves the NCCs and the Public Health Physicians of Canada delivering a webinar on a topic that was chosen through a needs assessment that went out to PHPC members earlier this year. The webinar addresses the core competencies related to health advocacy and professionalism. While this series is framed around competencies as they relate to medical officers of health and their responsibilities, they are also worthwhile to develop among physicians more generally, specifically physicians with the attributes listed here. We hold the view that all physicians contribute through their routine clinical activities to the achievement of public health goals at the population level. And so this webinar series has expanded its reach beyond the public health physicians and residents in Canada, including those working in clinical medicine, recognizing the Public Health Physicians of Canada's leadership role in promoting public health and preventive medicine, and the role of the NCCs to promote knowledge exchange throughout Canada's public health systems. Just before I turn it back to Donna, I do want to let everybody know that this webinar is an important part of a series of projects that the two NCCs are working on together to illustrate and share information on effective programs and information that can reduce tuberculosis in Canada. NCCID has co-led a number of events that have brought together expertise and community knowledge. The fact that we have Dr. Lux speaking to us today about her history that she has pulled together about the Indian hospitals is very important to understand the legacy that these hospitals have created and the way it has affected TB in Canada and the way people feel and respond to TB in their communities. Thanks very much, Donna.
Okay, thanks, Margaret. So briefly, today's webinar will provide an overview of the book Separate Beds, A History of Indian Hospitals in Canada. It is a troubling story of Canada's system of segregated healthcare. As Dr. Lux will explain, Indian hospitals were established to keep the Aboriginal tuberculosis population isolated and to ensure that other Canadians need not share access to modern hospitals with Aboriginal patients. Indian hospitals were underfunded, understaffed, overcrowded, and coercion and medical experimentation was rampant. Dr. Lux will describe the arbitrary and contradictory policies that governed Indian hospitals, the experiences of patients and staff, and the vital grassroots activism that pressed the federal government to acknowledge its treaty obligations. So at the end of this webinar, participants should have a better understanding of this history and its relevance to contemporary Indigenous health inequalities, have a better understanding of how Indian hospitals intersect with race, medicine, and public policy in the wider context of 20th century Canadian health. For the PHPM physicians and residents joining us today, you will have a strengthened CanMed's competencies in health advocacy and professionalism. It's my great pleasure to introduce today's presenter, Dr. Maureen Lux. She is professor and currently the chair of the history at Brock University. She studies the history of Indigenous state relations, health and healthcare in the 19th and 20th centuries Canada. Her latest book, Separate Beds, won the Canadian Historical Association Prize for the best book in Indigenous history, as well as the Royal Society of Canada's Jason Hanna Medal for significant contribution to the history of medicine. She is currently working on a history of reproductive politics in Canada in the 1970s. My great pleasure now to hand things over to Dr. Lux